Healthcare facilities must be ready for anything. A disaster is any sudden event that disrupts normal life, something that shakes a community to its core. It could be a hurricane, a chemical spill, or a public health emergency like COVID-19. Whatever the cause, nurses are right there on the front line when things go wrong. Disaster nursing means adapting knowledge and skills to meet people's physical and emotional needs in moments of crisis. It's about caring for others when resources are limited, communication lines are tangled, and the situation keeps changing. Nurses are often the first to see fear in someone's eyes, the first to offer comfort, and the first to find a way forward when systems fail. In these moments, their role expands. They become leaders, problem solvers, and advocates for both patients and peers. History shows that communities that plan for disasters do better than those that don't. Disaster planning isn't new, but it's vital. In the United States, the foundation for this planning comes from the National Incident Management System, or NIMS, which is overseen by the Department of Homeland Security and FEMA. Every hospital and community must have a plan that aligns with NIMS guidelines. These plans cover everything from terrorist events to natural disasters like floods, fires, and earthquakes. They even apply to industrial accidents, train derailments, toxic spills, and airplane crashes. Terrorism, in particular, is defined as the unlawful use of violence to intimidate or coerce people or governments. NIMS provides a structured, coordinated approach so that all agencies, from hospitals to local responders, can work together efficiently when lives are at stake. When a disaster strikes, the response happens at multiple levels: local, state, and federal. A mass casualty incident means there are more victims than the available resources can handle. When that happens, the focus shifts to providing the greatest good for the greatest number. It's a harsh but necessary mindset during crisis care. Communities must be ready to sustain themselves for up to 5 days before federal help arrives. That means hospitals need strong sustainability plans, stockpiles, and trained personnel ready to mobilize. Disasters are categorized by type and expected duration, and every facility should maintain a current list of local agencies, including contact information, to activate their emergency response quickly. Preparedness isn't just paperwork. It includes hazard vulnerability assessments, interagency agreements, and regular training drills. These elements build confidence and readiness, two things that cannot be improvised once disaster strikes. At the federal level, the National Health Security Strategy outlines how the United States protects citizens during large-scale emergencies. Its goal is simple: save as many lives as possible, protect property, and restore essential health services. Federal assistance is only activated when state and local resources are overwhelmed. Agencies like the Department of Health and Human Services, the Department of Defense, and the Department of Homeland Security coordinate large-scale medical and security responses. Nurses may volunteer with federal teams such as disaster medical assistance teams, which deploy rapidly to set up field hospitals and provide emergency care under tough conditions. These teams are self-sufficient for up to 72 hours and perform triage, stabilization, and evacuation during mass casualty incidents. The National Terrorism Advisory System, part of Homeland Security, issues alerts to inform the public about credible terrorist threats. These alerts can be elevated when a credible threat exists or imminent when a specific immediate threat has been identified. Non-governmental organizations also play a huge role. The American Red Cross provides shelter, food, and volunteer coordination after disasters, often long after the initial crisis phase has passed. Several federal agencies play key roles in disaster response. The Centers for Disease Control and Prevention leads in disease prevention and supports local health departments. The Department of Health and Human Services coordinates national health and medical services during emergencies. The Department of Defense provides military support and response capacity through branches like the Army, Navy, and National Guard. The Department of Homeland Security strengthens national counterterrorism and emergency readiness. The Food and Drug Administration ensures the safety of medical products, food, and devices even during crises. The National Disaster Medical System is a multi-agency system coordinating federal medical response teams, such as disaster medical assistance teams, disaster mortuary operational response teams, veterinary medical assistance teams, and national medical response teams for weapons of mass destruction. The U.S. Public Health Service is a professional corps of health workers, nurses, physicians, and scientists focused on protecting national health. The COVID-19 pandemic reshaped how we think about preparedness. The Centers for Disease Control and Prevention became the nation's voice for safety protocols, guiding mask use, testing, and isolation measures. Meanwhile, the Food and Drug Administration fast-tracked test approvals under emergency use authorization, a process that allowed quicker access to diagnostics before full validation. It was an extraordinary move that helped expand testing nationwide. At the state and local level, agencies coordinated responses with help from the Office of Emergency Management or the Office of Emergency Services. These offices oversee planning, logistics, and coordination among first responders. During COVID-19, FEMA partnered with the Department of Health and Human Services to ensure adequate medical supplies and support testing sites, a partnership that demonstrated how federal and local systems must align to protect public health. Every major emergency response operates under the Incident Command System, a structured, federally mandated system that coordinates people, equipment, communication, and facilities. It ensures clear communication, defined roles, and rapid deployment. It also manages hazardous materials, assigns the right protective equipment, and ultimately determines when an incident is officially over. In hospitals, this system becomes the Hospital Incident Command System. The Hospital Incident Commander, usually the Emergency Preparedness Coordinator, leads a team that includes operations, logistics, planning, finance, safety, and public information officers. Each member has a clearly defined role, and all communication flows back to the incident commander. The success of any hospital response depends on that chain of command and consistent communication under pressure. Disaster nursing is more than a skill. It's a mindset. It's about staying calm when chaos hits, communicating clearly when people panic, and using every ounce of training to protect lives. Nurses don't just respond to disasters, they anchor their teams through them. Preparedness, education, and confidence save lives, both in the hospital and out in the community.